Thank you, David, and thank you to everyone for joining us today. So as David mentioned, I'm the head of the cancer program at the George Institute, but like many of us, we wear multiple hats, and so with my other day job, I work as a radiation oncologist or a cancer doctor in southwest Sydney, so one of the most vibrant and diverse areas in Australia. And so the patients that I see on the daily basis in my clinic are very diverse. They include First Nations people, as the Campbelltown area is the fastest growing population of Aboriginal and Torres Strait Islander people in New South Wales. And they include migrants and refugees, and people who haven't had privileged lives, people who've often faced challenges, and on top of that, the diagnosis of cancer. And so it's a real privilege for me to work with these people and try to help them through this journey, which is often very challenging and very dark, the diagnosis of cancer, the treatment, and the aftermath of cancer. So I'm very dedicated to public cancer care. I only work in the public, and I do this because I believe that everyone has that human right to have access to the best quality and affordable cancer care. I come from a Malaysian Chinese family. My parents migrated here in the 80s because they answered a call for nurses, and there was a shortage of nurses, there still are, but that's why we ended up here. And interestingly, they really didn't want me to do medicine because they said they wanted grandchildren and that I'd be working too much and I wouldn't give those grandchildren to them. As it turns out, they still got the grandkids, but of course, after many years of specialist training, but they got there in the end. So culture shapes everything. It shapes, our family values, but also shapes how we view illness and how we navigate health systems, whether or not we feel that we can ask questions and we can advocate for ourselves in the clinic. So in southwestern Sydney, the inequities are stark. We have one of the lowest cancer survival rates in the country, and people are financially challenged, and that can then lead to people presenting later. They can often not access screening and often won't be involved in clinical trials, for example. So my work at the cancer program, firstly, we look at trying to improve treatments and to make sure that we can really keep working towards cures. But at the same time, we also design models of cancer care that are equitable, affordable, and culturally responsive. Because one question that really drives me is, what good is having all these amazing technologies and treatments if it can't reach the people who actually really need it? So one of the areas of research that we're interested in as well is this major challenge that within healthcare and in cancer care, there's populations that remain completely invisible. And that's because we don't actually collect ethnicity data when people come to our hospitals and our GP practices. For most people, we might ask what country they're born in, but increasingly this doesn't actually reflect their ethnicity. So for most of the Lebanese population in Australia, they're actually born in Australia. And most Pacifica people have been born in Australia and New Zealand. So currently they're actually invisible in our health records. So this is a major issue, because if we want to be able to understand why diseases are happening and then design solutions, how can we do that if we don't even recognize these people? So in cancer, for example, lung cancer in Asian women who don't smoke is actually skyrocketing quite rapidly. But we don't understand why this is happening. But worse than this, we can't even identify these people necessarily in our health records. So this is a real issue, and I think it's something that really needs to be addressed urgently. And actually in the UK, Canada, US and New Zealand, they collect ethnicity data, but we don't. We use this archaic system of country of birth, which is becoming increasingly outdated. So my work aims to transform the way that we collect ethnicity data in Australia by developing and piloting for the very first time a nationally relevant, standardised health data framework for identifying ethnicity in cancer care. There will also be a dedicated stream led by Kezia's group Gunamana, which will strengthen the identification and engagement of First Nations people. Recognising people's ethnicity will finally reveal care gaps in previously invisible multicultural groups, enabling targeted solutions and stronger links to culturally appropriate care. And this approach can transform demographic data collection beyond cancer and even beyond healthcare to other sectors within Australia. We're all abuzz about AI and the potential it has to transform healthcare. But the model needs accurate data, and if it doesn't actually represent all Australians, then it's not going to be useful. It's my career aim to overhaul the system to allow all people to be seen, so everyone has a fair chance at better health. And philanthropic support is going to be vital to my work, to give the time and intellectual space so we can design, test and refine these new models, to scale up the solutions of this pilot work, and then to take it national and even global. And so ultimately, so when someone sees me in the clinic, regardless of their background, their income, their cultural background, their ethnicity, they have the same chance of survival as anyone else in this country. Thank you.